know. So I'm Dr. Sarah Weston. I'm Director of Diabetes Behavioral Medicine and Psychology and a Clinical Assistant Professor at University of Florida in Gainesville, Florida. And I live with type 1 diabetes myself. I was diagnosed at 14, so not to give out my age, but it's been going on 2 decades now that I have lived with type 1, and so certainly appreciate some of the day-to-day struggles and have myself felt some changes and impact from COVID that I'm happy to share and talk about as we go through the slides today. But Kim will introduce herself, but we're going to be talking about coping and staying emotionally well during the time of COVID. So, Dr. Driscoll?
Yeah, so I'm Dr. Kimberly Driscoll, and I joined the University of Florida almost a year ago. And I am a clinical psychologist, just like Dr. Weston. I don't have type 1 diabetes, but I've been working with kids and adults and parents of those kids and adults for 13 years. And I am an associate professor at UF, and I'm the director of behavioral science research at the UF Diabetes Institute. And then I work with Dr. Weston closely, providing clinical care to our clinic patients.
Okay, so in light of that, we wanted to talk today about managing stress. Oops. Managing anxiety and stress during the time of COVID. So one of the first things that I just wanted to talk about was the normality of feeling stressed and feeling just like you're not quite your normal self right now during national, international emergency such as COVID. So we know that the outbreak of coronavirus or COVID-19 may be stressful to varying degrees for different people. So Lamari, when you're on the call today, feel free to chime in and talk. We want to hear from you, and we want to hear your story if you have questions and if you're comfortable speaking out. But one of the main things we just want to say and emphasize from the beginning, as my cat is Charlie joins the call, everyone is going to react to COVID differently, and everyone's going to have different experiences during the time of COVID. So listed on the slide here are just a group of people that might be at higher risk for feeling a bit of distress and a bit more anxious right now. And that might be older people or people with chronic diseases or families with a person living with a chronic disease like diabetes, who might be either at higher risk for contracting COVID or might be at higher risk for healing once they do happen to contract COVID. So there might be some additional worry there about the safety and well-being of yourself or loved ones. Children and teens can be especially confused or feel distressed or overwhelmed right now. First-line providers, healthcare providers, and people who've lost financial resources. So really keeping in mind this can be a continuum of an effect from maybe minorly impacted to severely impacted, like you lost your job, or maybe your family's primarily, who's ever responsible for income has lost their job and you can no longer get by day to day the way that you used to. Also of note, people with mental health conditions, so predisposed anxiety, depression, things that had been happening before COVID, are not exempt during COVID. And so those symptoms may be exacerbated, and those people may have a more difficult time during COVID. So stress can include fear and worry about health, fear and worry about finances, changes in sleeping patterns can happen, difficulty concentrating, worrying about your health conditions, and actually worsening of those health conditions can occur. Some people can turn to alcohol, tobacco, other ways of coping that may not be optimal. So this can look very differently for different people. So Lamari, did you want to tell us anything today about maybe your experience with stress and COVID, or if any of this resonates for you in light of diabetes or other things?
Well, I've been diabetic since 1973. I was diagnosed at 2. And I have a son. He was also diagnosed at 2. He's going to be 14. So there's 2 diabetics in the household. And I mean, we've been lucky. We've been blessed that my job and my husband's jobs allows us to work from home. And my children are at home because school is not being taught at the classrooms. So I I mean, I do feel worried about what's going to happen when they say, okay, let's try to go back to normal. And I have a fear that eventually we will get it. And so I guess we'll have to deal with it. I don't know, maybe I shouldn't worry about that, but that's really what's going through my mind right now.
Yeah, thank you for sharing that. So it sounds like there's some general worry about, that things have to go back to some resemblance of normal at some point, but there's this fear that you will eventually get COVID if you aren't a carrier or haven't already, and what that might mean for your family. And also, I heard you say you're breaking up in the beginning, but you have a 14-year-old that was diagnosed at 2. Is that correct?
Yes.
Okay. And I missed if you have other children.
Yeah, I have a 17-year-old. She's supposed to graduate from high school, and she didn't go to prom, she didn't go to grad bash, so that's pretty stressful on us and her. I think she's coping. I think she's doing the best she can, but my son, he's diabetic. He was supposed to graduate from 8th grade, so they were both going through graduation events that are not happening. So I think that brings another layer of disappointment in things that just can't happen, that were supposed to happen.
Sure. So I'm hearing a lot of these stressors go beyond diabetes, but may end up just sort of bringing our baseline stress levels and disappointment up a bit, and might impact just our day-to-day quality of life. And I know for myself in living with diabetes that some of those disappointments I found add on to my stress level, which in turn can impact my blood glucose levels if I'm feeling really stressed or isolated. So certainly those things can sometimes go hand in hand. Thank you for sharing that. I noticed a couple more people joined the call. So I wanted to give those people just a chance to say hi. I see there's an Emma on the line. Do you want to say hi, Emma?
Oh, you unmuted me. Can you hear me?
Yes.
Okay, cool. All right, yeah, this is actually Emma's mom. Emma's upstairs, so she's the diabetic. So I am Corey.
Hi, Corey.
Hi.
You want to tell us just a little bit about yourself, how old Emma is?
She is 12, and she was diagnosed when she was 4, about ready to turn 5. So she's been handling this great. We're doing fine. We have lots of stuff to keep us occupied around our house, and she's been doing a lot of good schoolwork and reading and catching up on things. And she has a sister who's 14 who she plays with, and they get along great. So we're actually really blessed to not have that much stress. My husband and I are both still working, so we're still making money, so we're still good. So I'm just watching just to see if there's anything. I mean, I am totally curious too about, there still is the fear of going out and, bringing it home, and what would happen to her if she were to get it for the type 1, well, either of the kids. But, I guess that's just the chance you kind of have to take. Can't stay in home forever. So.
Right.
Well, thank you for joining. We are happy to have you here, and we will talk a bit more directly about anxiety related to COVID in a little bit, where I think that like fear of potentially catching it or what's that going to look like might come into play a little bit more. So thank you for joining. And there's a couple more people on the call. Erica, can you see who else joined?
There's one that says just iPhone.
Yes.
Me.
And
That's
you muted that person. Do you want to introduce yourself? We can't see your name.
Oh, I'm sorry. Hi, I'm Debbie.
No, you're fine. Oh, hi, Deb.
Hi, Debbie.
Hi.
Debbie.
But yeah, well, this has kind of put me under stress because I can't go anywhere. no. But no, I'm okay with it, really. It's, you do what you have to do, I guess. And I'm just,
And are you the mom of a child with type 1, or do you have type 1 yourself?
yeah, I've had type 1 for 51 years.
Okay.
But yeah, no, I mean, you just have to do it, try and do it, stay as safe as you can, but especially now. But, it is, I mean, I don't have a lot of anxiety exactly, except about they close all my stores. But other than that, I'm good.
Good. Well,
Right.
nice to have you, Debbie.
Nice to talk to you too.
And then
I'm
I'm Wardsburg.
Can you
what's that?
can you hear me?
Yes.
Yeah, I'm on my phone. I don't know
Oh,
what
now we see them.
I'm on my phone. So I'm Stephanie, and I am the mom of Brock, who is 11, and he was diagnosed when he was 8. And he has an older brother who's 14. So they're kind of like two peas in a pod for the most part. And we're kind of, self-isolating. Oh, my husband has to work outside the home, and he is a physician. So we have a whole decontamination type process that he goes through to get back into the house. And I'm a nurse, but I'm not working because of my own autoimmune issues at the moment. So we couldn't isolate my husband separately. I need his help at home. So we're just sleeping in the opposite ends of the house. We're not hugging and kissing, sharing utensils, that kind of stuff, and just doing copious hand washing and, hoping that some of the stuff we're putting in place where his patients wear a mask and he wears a mask, and if you go to the grocery store, there's a mask, that if we do get COVID in the second round or so, that only one of us gets it, to be able to isolate and maybe not have like all of us end up with it around the same time. We don't have any family in the area, so it's a little stressful thinking about who would care for Brock in case, if we were both sick or whatever. So, I mean, there's a lot of scenarios, a lot of what ifs, and you just got to keep plugging along and try to do the best safe practice that you can.
Sure. So thank you for sharing that, and thank you for joining us as well. So it sounds like there's a lot of, even just in the small group of us here, there's a lot of differences in everybody's situations right now, and what you're doing to cope, or what you might have as your general routine at home. And so that takes us in. There's just 2 slides here. I'm not going to read all of this. We can share these slides with you later if you'd like. But I read an excerpt online last week that said we are not in the same boat. And I really liked it because it started off by saying we're in the same storm, but not in the same boat. And it gives examples about how different families are experiencing different things right now. And some people might be really, really struggling, whereas others might just be coping fine. And it's just kind of a disruption to their everyday routine, but they're coping okay. So noting that for some, quarantine is optimal. It might give them, a period of reflection or a time to cope and just enjoy a sense of calm. And for other people, this might be really a period of extreme crisis for their families, where potentially their incomes have been lost, or they've lost a loved one due to COVID. There's a second slide. It kind of continues these examples. Where some people may really be out of work and want to go back to work and not be able to, whereas others maybe are not struggling with that same situation. Certainly people that have children are needing to brainstorm how to homeschool or do different things for their kids and to keep their kids safe, whereas others may be caring for an adult or an older parent during this time. So we say this just to put this in light, because I think it's important to consider that there's really different scenarios for different families. And maybe what's working for you, or what might feel safe for you, is not what's working for your neighbor or another loved one or another family with type 1. So just putting that in perspective a little bit and doing some self-reflection and thinking about that can be useful at times. And we do want to bring up health anxiety and diabetes related distress during the time of COVID. Just to note that when we talked about this is, the same storm, but we're not in the same boat. people that live with diabetes might have some similarities and might be going through some similar distress, even if they're not in the same boat. You know, we're all weathering the same storm. And so thinking about diabetes and COVID-19, I heard several of you say in the beginning, like, what happens if we get it and we have type 1 and the anxiety that might be related to that, or thinking about what changes you need to make in your life if that were to happen. Most recently talking about if you're a caregiver of a child with type 1, what happens if you get sick? And then are you going to be able to be there to care for your child? So these are all extra stressors, I think, that people are thinking about right now, which means that people with diabetes may feel particularly worried or may feel more anxious and distressed than someone that, say, doesn't have a chronic health condition. And we know that people with diabetes are more prone to depression and anxiety already, not even thinking about COVID, but just at baseline compared to the general population. And so during a natural disaster or crisis such as COVID, that predisposition can cause some of those symptoms to increase even more. So thinking about and paying attention to your own, mood, your own symptoms, your child's mood and symptoms, and monitoring that can be really useful. So there's currently no direct evidence about management of diabetes-related distress and anxiety during COVID. It's just been too soon for us to do psychological studies to really see how distress or anxiety has changed. But I think Dr. Driscoll and myself, and just talking to different families, can kind of say anecdotally that we have noticed change in distress and anxiety in people living with type 1, but again, to varying degrees based on what your family is going through right now. A couple of studies that have been put out about crises in general tell us that women may be at higher risk of deprioritizing self-care and general health care because they are relied on as primary caregivers. So thinking about how can you prioritize your own self-care, as there's a lot of women and mothers on the call, to ensure that you stay your least distressed self and you're engaging in self-care right now as much as possible. We know that also adherence can worsen when people are distressed or have depression. So when we say adherence, that means basically doing what you need to do to stay healthy, living with type 1. So are you checking your blood sugars or your child's? Is insulin being given as it should be throughout the day? Are you attending medical visits? Are you able to attend medical visits? And thinking about how to problem solve when there's barriers that might happen. We know that that can be more difficult during a time of crisis. So it's something that we can talk about and kind of walk through with you today if that's something where you're struggling. And in general, adherence can worsen during disasters. So we don't have a whole lot of data on COVID yet, again, but we can compare this to other natural disasters or other crises that have happened in the past. And the research there does suggest that distress can be elevated right now. So I'm going to pause for a second and just ask if anyone on the line has experienced any of these feelings related to diabetes, or if you've noticed any changes in routine with management. Does anybody want to chime in there?
And just so you know, you are all muted. So if you'd like to say something, you can go ahead and unmute yourself.
So being at home all together all the time, it's more of a chance to ask my child if he's checking his blood sugars, taking his medication, counting carbs. And so as sad as it sounds, the nagging shall increase just because we're together. So he probably doesn't like that because when he's at school, he self-manages. So now that he's at home all the time, he just hears me asking more. My husband asks more. So I'm sure that brings another level of anxiety for him. But I mean, it's not much I can do. So that's what I think.
Yeah. So I heard you say, like, you and your husband are asking your son more about if he's doing his management tasks because you're seeing him at home throughout the day rather than him being at school. Dr. Driscoll, I don't know if you want to chime in here, but the one thing I would say to that is just make sure your lines of communication are really open with him. And sometimes it can be really powerful to even sit down and say, hey, I know I'm asking you about diabetes a lot more right now. And for me, it feels like I'm sometimes maybe over asking, or I feel like you might feel I'm nagging you right now because you're home all the time. And what can we do to help, each of us feel better about this situation right now? And you might ask him how he's feeling about it. Sometimes what you perceive is maybe not what he's perceiving. So having him sort of have an open way to answer how he's feeling right now about diabetes and how he's feeling about you asking him more questions. And if he's not feeling good about it, that gives you an in to talk about how can you problem solve and maybe make it so that you both have a balance, where maybe he could check in with you or be proactive about some of these things in advance, or you could have set times to ask questions throughout the day. So just making it so that you're on the same page with him, and giving him an opportunity to be really, really honest about how he's feeling without fear of being punished or without fear, of being yelled at for doing things wrong. But then conversely, it gives you an opportunity to be really honest with him, about how you're feeling and about how maybe you think you could improve or why you're concerned about his behaviors right now. So sometimes we tend to put those things, it's like a big elephant in the room and we don't talk about it, but sometimes really sitting down and addressing it and having a conversation can take the edge off and be really useful. So that might be something I'd recommend. I don't know if Dr. Driscoll, if you'd recommend anything else.
Oh, I completely agree with you.
Hey, cool. All right, so I was just, I guess my only thing was Emma had her 3-month endo appointment, I don't know, like 2 weeks ago, right in the whole midst of this. And I was like, nope, I'm good. I'm not going. There's no way I'm going to take her into a doctor's office full of people with who knows what kind of issues. So I'm feeling a little guilty now of like not taking her, but really her blood sugar's been great. She's had the most, for her Dexcom Clarity has been the highest it's been ever in the last like week. So, really, I guess with her being home, I guess personally, I feel like I'm good not taking her. I mean, I don't know in like what other people's opinions of that are. Like, should I wait another 3 months or like try to go soon? I'm just like worried about that part the most, I guess, taking her out to the doctor because she hasn't left this house in a month.
Yeah.
Does your doctor's office offer any appointments through telehealth? And I think, especially if blood sugars are in target range and she's doing well, and Dr. Weston, you can talk more about this as someone with diabetes, but I think that's a perfectly fine decision to make. But I'm wondering if your doctor's office is offering any telehealth services for appointments. That's one thing that's been happening across the country.
Mm-hmm.
They've said, I mean, they haven't offered it. She just asked me if I wanted to reschedule the appointment, and I said I'd call her back, and I just called back.
Yeah. Okay. Yeah. That's totally fine. And for everyone who is on the call today, keep that in mind that a lot of practices and medical clinics have converted to telehealth. So it might be a possibility, but then again, it all depends on the practice. But worth asking if you feel like you want her to be seen before.
Mm-hmm.
All right. I mean, I don't think she needs to be seen. I think she's fine. She's totally healthy. So, I mean, I'm good. Like, I guess I just feel guilty because it's like always been a 3-month thing. We've just never missed an appointment. It's always been that, but really, I'm sure the doctor's not going to tell me anything that I don't already know by now. I don't know.
Well, one thing when you are feeling guilty to think about is you made an informed decision about how to keep her safe, right? And the trade, even though the risk is probably low, but you don't want to risk it with her, with getting COVID. And so you made, you used your mom instincts and an informed decision to make sure that she stays safe. So you can forgive yourself for missing this one appointment, and you can definitely blame COVID for it.
Right. Okay. Thank you.
Yes.
I would second that. I think like it's a risk benefit thing. So, if your child was struggling really, with high blood pressure, feeling like you had a poor grasp right now on management, then it might be that the risk of not seeing the provider is higher than the risk of actually going and potentially, being exposed to some germs in that environment. So I would agree with Dr. Driscoll that you did your role in kind of making a proactive decision. The only thing I would add is to think about why management is really good right now for you and your family, and sort of what's going on that maybe is leading to those stable blood glucose levels or helping with that. And thinking about what behaviors you're doing now that maybe you can continue doing when things start changing again, and maybe going back to normal if she goes back to school, what that's going to look like. So how can you keep up with what's working right now? And I would just ask yourself that question, and maybe, think about what routines you're doing that you could continue carrying on into the future when this all settles a little bit.
Right.
But that's great that things are stable and doing well. Okay, well, let's move on to the next slide here. Dr. Driscoll is going to take over this one. Oh, she's muted. I can unmute.
I got it.
Great.
So during this time, it's really important to reduce stress in yourself. Especially, I've been hearing from my friends who have kids who don't even have type 1 diabetes about how they're really struggling with how to manage everything, in terms of trying to work at home if they work out of the home, balancing schoolwork and getting everything done, but then also kids are getting to the point where they're getting pretty antsy. Some are distressed about not being able to see their friends. And so it's important that all of the signs of stress be recognized, but then also that you all take care of yourselves. And we'll get to some strategies in a little bit. But in particular, if you see any of the following in any of your family members, that anxiety, worry, or fear, not just about COVID, but maybe about other things, any changes in appetite or energy, difficulty concentrating, difficulty sleeping, or having nightmares or upsetting thoughts. A big sign of stress in kids is the physical reactions. One of the most common physical reactions is headaches, complaining about stomach aches or body pains. They also express their frustration with anger or irritability and having a short temper, particularly in younger kids who aren't able to use words to articulate how they're feeling. And then hopefully this is pretty limited, but sometimes we'll see in our teens use of alcohol or tobacco or other drugs as a common sign of distress. But hopefully we're not seeing a lot of that, because everyone should be inside. Okay, so you want to?
Sure.
Thanks. All right, so one strategy is whenever you're feeling overwhelmed about something, what happens is we have this automatic thought, and I don't know why it is that human beings automatically they just jump to the negative. And I will admit that I do that myself. It just seems to be like intrinsic or natural for us to do that. So oftentimes we'll think, I can't do this, I can't cope with this feeling. And in therapy, what we try to teach our patients is to replace those negative thoughts with either a neutral thought or a positive thought. So if you're feeling overwhelmed by, let's say, trying to manage the schoolwork and teaching your child or children a new concept that you haven't studied for years and years and years, you can tell yourself, I notice that I'm feeling whatever that feeling is. anxious, overwhelmed, frustrated, maybe inadequate if you don't know how to solve certain problems on their schoolwork. But then you need to tell yourself that this is okay. You're doing the best you can. I like that counter thought, and I've been telling a lot of my friends that too, that we're all doing the best we can in a really stressful situation, that it's okay. Whatever you're doing is okay, and that there is a light at the end of the tunnel and this will pass. We just don't know when that is, unfortunately. But kind of forgiving yourself, like I mentioned earlier, for not being able to do everything the way that you would be able to do it under other circumstances. So it was probably before COVID a lot easier, although not completely without difficulty, to manage homework. But now you're doing the teaching and the homework. And it's just too much for people, to be honest. And you have to forgive yourself and just tell yourself that you're doing the best that you can in those moments. Mm-hmm. Has anyone found that themselves having those automatic thoughts, those automatic negative thoughts?
Remember to unmute yourself if you want to talk.
And maybe no one does, and that's fine.
Okay.
Yeah. Did you want to add anything to that, Dr. Weston? The other thing I would say is it takes a lot of practice to do this, and you have to really be committed to countering the negative thoughts in your head with those neutral or positive thoughts. It takes a lot of practice. Oh, Emma, did you want to say something?
Oh, no, I was just unmuting in case I did want to jump in there, but I'm good.
Okay. Did you want to add anything, Dr. Weston?
No, I think that's great. I just would reiterate that I think it's very normal to have these negative thoughts happen, and that they can be fleeting, but sometimes they can stick around longer than we want them to. And so being really patient with yourself about that, and exactly like Dr. Driscoll said, to acknowledge that you're doing the best you can. And some days that's going to be more productivity than others, and that's okay. So being really patient with yourself there. And I think this slide actually gets to that. So
yeah, okay. So also you have to keep in mind that everyone's coping abilities are different. Our coping ability as adults is much different than what your 5-year-old is able to cope with, or your 10-year-old, or your 15-year-old. So it is definitely developmental. And one thing to keep in mind is to have reasonable expectations for coping. And I know it's really hard for parents to, because in the moment you get frustrated that if your kids are having trouble coping, and they may act out or express that frustration in ways that you really wish that they would not use. But it's super important for you just to recognize and accept the developmental differences in coping. Some people, they kind of, they overfunction, or they jump into high gear. They keep themselves busy at all time. They complete a ton of tasks whenever they're anxious or feeling hopeless or powerless. And then other people underfunction. They have a little bit of trouble getting going. They're just kind of feeling like they're going through the motions. They're slowed down. They need rest. They keep things to themselves. So both ways of coping are completely acceptable and valid, and neither is right or wrong. And it's also not all or nothing. And so what I have found since we've been self-isolating is that I have some days as a overfunctioner, and then it could be the next day where I'm underfunctioning, and I'm just like, I can't. In fact, I'll be quite honest. I had a day like that on Friday. Thursday was super busy and I was able to keep things going. And then Friday I just kind of crashed and couldn't get anything done. And so it's really, really important also to accept the differences in coping. And that could, especially in kids, that can vary within a day. You know, after a good night's rest, your kids could get up and feel really good. They have a good meal. Blood sugars are pretty good and they're doing great. And then they have a meltdown later in the afternoon because they just have gotten overwhelmed.
Mm-hmm.
Has anyone experienced that? Anyone want to share anything? Okay, that's fine.
Yeah. I mean, I would reiterate exactly what Dr. Driscoll said, and that she and I are very similar in that we go back and forth between over-functioning and maybe needing rest, and that's okay. I too have some days where I'm super productive from the time I wake up to the time I go to sleep. And, conversely with diabetes management, I have some days where I'm so on top of it, and, some days with really, really stable blood glucose levels. And that in turn helps me be even more productive because I feel good. But then other days where for no rhyme or reason, that's not happening. And whether it's diabetes at play or just my mood and my own anxiety related to COVID or changes in working from home, that can result in some days where I just want to slow down and I want to just kind of, give myself that time to relax and regroup and get the rest I need so that the next day can hopefully be a bit more productive. But being patient with yourself, I think as parents too, about your role as a caregiver, sometimes that your motivation and your will to caregive can go up and down. And that doesn't make you a bad person. It doesn't mean that you're wrong for feeling like you need breaks sometimes. I think sometimes it's even more important to give yourself those breaks and that permission to slow down because it's going to keep you healthier and more stable in the long run. So just keeping those things in mind.
And I would just like to add that philosophy applies to non-COVID times too. I know it's hard when you're working, taking care of your children, doing homework, running around, having to do all the extracurricular activities, and then managing type 1 appointments or the daily care. So even during those times, it may be even more important for you to take time to take care of yourself because there's so much more going on during those times.
Very, very true. So we have a slide here about supporting yourself during the time of COVID. And this can be supporting your child as well. But remembering a couple things, we mentioned this in the very beginning. I'm not sure if everyone was on the call yet, but thinking about people with pre-existing mental health conditions, those mental health conditions are not just going to go away during a time of stress like COVID. And so thinking about how you can stay aware of your treatment and your symptoms, following up with healthcare providers, making sure your medications are in stock, making sure you're getting the support you need to stay well is really, really important. Conversely, other people might find that some stressors are now absent from their life. Like maybe your child was really anxious about tests at school or about peers at school. I have a couple of patients who are bullied at school, and now that stressor's kind of actually been removed for them because they're at home and they're actually doing better coping. And that's good, but we also want to still think about when they transition back into the school environment, what's that going to look like for them? And now might actually be a really good time to build them up with some coping skills so that when they do go back into school, they've practiced and rehearsed these coping skills and they can go in stronger and sort of have that self-protective, shield up when they go back. So thinking about that, things you can do to support yourself. So there's a great list on this slide. Setting a schedule. So cannot emphasize enough how important it is to really try your best to keep a routine and set yourself on schedule and to help your children do the same right now. So of course it's going to be a bit normal if not being in school or not maybe working at a certain time in the morning that you might be sleeping in or your kids might be sleeping in longer than typical. And I think there's wiggle room there for, some leniency, but at the same time trying to wake up a resemblance of a normal hour and trying to set that schedule so it's the same every day. can help your child stay on track, feel more productive. It can help you stay on track and feel more productive. And then when we do transition back into these routines again, whether it be a couple weeks, a couple months, it's going to be an easier transition because they haven't gotten so astray from their typical routine. Also, sometimes when we don't have a routine and it's just kind of a free-for-all, not only does productivity go down, but your mood can go down too. There's something about that set schedule and having a set structure with leniency and room for movement, but something to keep your day kind of moving can increase your productivity. So having small goals. Something that I try to do on days where I do have to be productive is I'll wake up, I'll take a shower, I'll sit at my desk, and actually look at the clock and say, in 2 hours from now, I want to have this specific goal accomplished. And that might have been a half hour if I had been in my desk at work, but I give myself a little bit extra leniency and permission, but still set small goals throughout the day. You can do that with your kids too, whether it be schoolwork or homework, or chores around the house, or just moving, being, active in some regard, but setting small goals can really help you achieve those outcomes. Remembering to take care of your body. So this is really important, making sure you're still getting sleep, making sure you're still eating, trying to eat balanced meals. And of course, these are recommendations we want all the time, not just in COVID, but COVID can make some of this stuff a little bit harder. So for example, eating, you might be a bit weary about going to the grocery store. Some people might take out food more often than usual or less often than usual. But thinking about what that means for you and your family and your life and how you can continue to get nutritious, balanced food to stay and feel the best you can. Connecting with others, talking about your feelings. Now this can relate to diabetes too. So we mentioned at the beginning of the call where a mom felt she was maybe asking her son more about diabetes. Thinking about how you can continue those discussions within your family about your feelings around diabetes right now, your feelings around COVID right now. Typically, when we hold in our feelings about things, especially when they're anxiety provoking, it can end up coming out as anger or irritability. So it's important to try really hard not to hold those feelings in. And contacting your health provider if stress, gets in the way of daily activities. Just thinking about, monitoring your own mood and your child's mood, and if that becomes something that you're worried about, letting your healthcare team know. So the little icon on the screen, I really like this. There's just gentle reminders of things like setting boundaries for how much media you consume. I know for myself, I can turn the news on and get lost in it. I can have it on for 3-4 hours while I'm cooking dinner, while I'm eating dinner, while I'm sitting down at night, and lose track of time. And you're sort of absorbing all of this, oftentimes negativity that we hear in the media and on news. So setting limits and boundaries of that. Yes, it's important to stay informed, but sometimes it can drag you down maybe more than you need. Opting out of overwhelming discussions. That doesn't mean not admitting to your feelings or talking about your feelings, but sometimes things are just a bit too overwhelming and you need to step back, and that's okay. Understanding others' fears. So as we talked about in the beginning, sometimes people might have a very different situation than their neighbor or their sister or their brother or some other family that they're close with. And they might not understand the fear that another family is facing right now. So trying to put yourself in their shoes and being respectful and understanding of other people's struggles right now is really important so that we all have a sense of safety. And in turn, it will help others understand you and your situation better, being a family of someone living with diabetes. Focusing on the things you can control, being mindful when things are becoming more than maybe just informed and you're hearing the same stories like the news over and over again. One last thing I'll say before we change the slide, there's this repetitive theme of staying connected, which is really hard when you can't stay connected in person as much as you may be used to. And so brainstorming strategies of how you can talk to other people right now. For myself, I have on Sunday afternoons, actually just had it before we joined this call, I have a family Zoom session at 3:00 every Sunday where I have family members from multiple states and we all just chime in and talk. And sometimes we have nothing to say and it's a little awkward and we're just, sitting there talking about our day or our week. But other times someone might have a story to tell and it's just a way to see faces and stay all connected right now. So as much as you can do that in your families or with extended family or friends or other loved ones, I think that's super, super important. Dr. Driscoll, did you want to add anything to this slide?
Nope, I'm good. Sorry, I had to unmute myself again.
That's okay. That's okay.
Yeah.
Okay, and so this is just a quick slide, and every link that you see here, we can send you a sheet with all of these links, but there's just different resources to link you to. There's some great apps for your smartphones that can help talk you through anxiety exercises, some different ways to practice deep breathing and meditation. We do a lot of that in psychology and thinking about how we can slow down and just sort of feel how our body is feeling and try to mitigate that response a little bit. But I really liked this icon. It says, hey, it's okay if, and then it has a list of things. If you feel uncertain about the future, if you're seeking comfort and calm, if you're struggling with routine disruption. One thing I want to know, it's okay if you allow yourself to feel joy. So sometimes in really difficult times like COVID, we struggle and we maybe feel guilty for feeling super happy or for feeling like, say, your diabetes had a great day or you're doing really well with management. Sometimes that can bring on feelings of guilt because you know that's not true for other people right now. And I can't emphasize enough how important it is to really allow yourself to feel joy and allow yourself to be thankful for the things that are going well and the things that are going right. And that doesn't mean that you're not empathetic of other situations. It just means that you're allowing yourself to appreciate that own stability in your life if you're feeling that. Conversely, that might not be an all or nothing either, where, you know, some days you might feel really thankful for one thing, but simultaneously be feeling very sad or anxious about something else. And it's okay to feel grief and struggle at the same time that you feel happy. Those don't have to be completely separate emotions. They can co-occur. And so recognizing that that can happen, I think, can be a really helpful strategy to not feel guilty and to be appreciating all of your feelings at the same time. So again, we can link you to these resources, but there are some great apps to just practice calming and deep breathing exercises right now if you're struggling with some of those anxious feelings. All right. This was just a nice quote, but Dr. Driscoll can take over from here.
Yeah. So I'll read it. So the very last thing we need right now is a mindset of mutual distancing. We actually need to be thinking in the exact opposite way. Every hand that we don't shake must become a phone call that we place. Every embrace that we avoid must become a verbal expression of warmth and concern. Every inch and every foot that we physically place between ourselves and another must become a thought as to how we might help that other should the need arise. And I really like this quote for many reasons. I think what all of us are experiencing, and particularly our kids, is that the social distancing has highlighted to us how social we are as human beings and how we thrive on it. And since that has been minimized and in some cases taken away, it's really important to fill the void with other means of socialization, even if it's not in person.
Mm-hmm. Mm-hmm. I completely agree with that. Does anybody want to comment about any strategies you've used to maintain social connectiveness right now? Anything that's been helpful, like in your own families?
I just make it a point to just call people. And, you know, a few weeks ago when this all started, I had the mental thought of, you know, there's a lot of people that your acquaintances or friends or whatever that you don't really see or talk to. So in all this, for my mental health as well as everybody else's, but I was like, I'm going to make a point to call somebody at least once a day, like one person a day. Yeah. And just be like, hey, how's it going? Because, you know, we all have Facebook and social media and we do that and we see how everybody's doing, but it's not the same as actually calling somebody or, you know, FaceTiming somebody. And, you know, I feel lucky enough to have a best friend who lives very close, who's like Emma's second mom, who does everything for Emma. And, you know, she has a daughter too. So Emma has some close friends that are type 1 diabetics that live close to us in our area. So while we can't be together in person, we still make it a point call or FaceTime or, something to maintain, I guess, a sense of normalcy. But it's kind of weird for us because like Emma would never leave the house if she didn't have to. Like she's totally happy being home and, chatting with her friends on the phone and, playing outside, and we have a pool and stuff. So they're out playing and running the neighborhood and, doing all kinds of stuff. So she's loving the school, doing the computer and doing her stuff from home and playing. And so
Good.
it's been really good for her, I guess, which maybe I was thinking about your question earlier, Sarah, I'm sorry, maybe Kim said this, about, what am I doing now? Why are her blood sugars so good? And I was just sitting here thinking about it. I'm thinking probably because I'm asking her every 10 minutes. Probably because I'm like on her constantly. I'm like, okay, I just got to alert, what's your blood sugar? And I can see her, you know what I mean? Like we're here. I know when she's in the refrigerator. I know when she's trying to get snacks. I know, when she's eating and when she's not, and can bolus it right then and there, and I can make sure she goes outside. I guess just the control of it, right? So when she's in a school or other situations, obviously can't control what's in school, even though her nurse at school is amazing, and helps me a lot. But I guess really just being constantly aware of it.
Yeah.
And, for her, I mean, I don't have type 1, so I don't know personally for myself, but Sarah, you have
Yeah.
type 1? Yeah. So I guess maybe you feel that way too about like, you have to think about it 24/7, right? It like doesn't go away. So, even though I think about it 24/7 because it's my child, but, I hope that I don't put that stress on her to do that. Like, yes, you have to manage, and yes, you have to know how to take care of yourself and manage your blood sugar, but it's not a do all end all. It's not, it is manageable, and it is something that you can take care of. Right. So, she doesn't, I mean, I guess she doesn't stress about it. She never really says that she's stressed about it, or she never really acts out. And I mean, she's good, I guess.
Good.
That's good. That's really good. And I liked how it sounds like things are maybe good right now for a variety of reasons, and not that they're not outside of COVID as well, but certainly you mentioned having more oversight of what's going on right now. And you know what she's eating, you know where she is, you know what she's doing, you can address that right away. And so that might just be something you think about moving forward when this new routine shifts again into something else. Like, how can you maintain that responsibility sharing? Of course, it's going to budge a little bit. We know where she's at school, or maybe you don't know, if she's at a friend's house, what she's eating. But thinking about even having that conversation with her now and saying, I've noticed your blood glucoses are really good now that you're home, and like we can both monitor this together, and we can make sure you're getting your insulin when you need it. How can we think about keeping that going when maybe you're not home all the time? And that'll do two things. It'll get her thinking about, hey, you're right. Like, this is the pattern right now. And when we pay more attention, I have better results, and I feel better when we pay attention. So it'll drive that message home. But then also when she's feeling good, you can be a bit proactive about brainstorming with her some strategies of when she's not in your eyesight all the time, what that might look like to continue to maintain that responsibility sharing piece with her. So those would just be my thoughts about how you can keep that moving. And the only other thing I'll say there is, you mentioned she loves being home. And so she, likes to go swimming and likes doing her schoolwork on the computer. And that might be really reducing her stress levels right now. And so we know stress can be a big impact on diabetes management. For me, when I'm stressed, my sugars go super high and I struggle to get them down. And really, the same amount of insulin that would work on a day where I'm feeling stable and not stressed isn't working on a day where I'm very stressed or overwhelmed. And so it could also be that it could be her mood and helping her stay, in target range. And so again, thinking about if she does enter a more stressful environment at some point, how she can work on maintaining that sense of what's happening right now. Conversely, somebody else might hate being at home, right? And they might feel locked up. They might thrive off of going to school and seeing their friends. So maybe now the glucose look worse because of this. And it can be anywhere in between. It can shift. It can go back and forth. So I think just noticing that and trying to piece together these patterns for yourselves, what's changed, what's different, what's working, what's not working. Those are great questions to ask yourselves and have conversations about them. Don't just let these things happen in the background, because the conversations are going to be what ultimately leads to change over time. So I think that's great. I'm glad she's enjoying being at home and being in the pool and doing those fun things.
Yeah.
All right, we'll go to the next slide.
All right. So these are just some more tips on managing any anxiety or worry. Just to recap, I think, avoid excessive exposure to media coverage. I know I think Sarah had mentioned this, that she was doing this early on. I was watching a ton of news, and I found that I was on edge and that my own anxiety about it was creeping up. And so I hardly watch the news now for that reason. And I have found that to be really helpful for me personally. We talked about connecting through calls and text and the internet, adding extra time for daily stress relief, and the importance of practicing self-care and focusing on your own mental health, because when you are in a position of less stress, less anxiety, you can be a better parent to your children. So for kids, reassuring them that they're safe and that you are going to do everything in your power to keep them safe. It is really important to give them an opportunity to talk about their worries, but also to respect if they are less talkative, and not to sort of badger them to talk if they're not, if it's not a good time for them, because sometimes for kids, talking about it increases their worry. Sharing your own way of coping, but then also just not sharing it, but modeling it to your kids is really, really important. So modeling your coping. And then also, I highly recommend that you engage together in coping. So I have a good friend, and she has 3 kids at home, trying to school them. She works full time. And I think like around 2:00 in the afternoon, they all pause and they pull up a YouTube dance video, and they all engage in it together. And they have a lot of fun doing it. I've seen some videos that she has taken. And so it's little things like that you can share with your kids. It helps you to cope, and it helps them to cope. Super important to limit their exposure to news, and like we said, create a routine. And keep yourself busy. Think about board games, books that you guys can read together, movies. You can even find videos on YouTube on how all of you can do relaxation techniques. I think that would be a really great thing. Incorporating them into cooking and just other daily activities that could become a lot of fun.
Mm-hmm. Okay.
All right. And then for kids, have a dance party. So I don't know if you guys are experiencing that kids are getting bored. I've heard a lot of that from students and friends. So, and I think we covered a lot of these. Going outside and searching for spring is a good one. You know, there are a lot of videos on YouTube to engage in art projects and creative things for kids. There's this one guy, I don't know if anyone's heard of him, but his name is Mo Willems, Willems, and he teaches kids how to doodle, but it's not doodling like we think about scribbling on a page. It's like the doodles he creates are cartoon characters from his books, and kids love it. And I've actually thought I would like to learn how to doodle from him. So there's lots of things that you can find online that can be instructive, but not like formal schoolwork and kind of more like chores. Journaling is a really good idea. And I actually, if anyone is interested, I can give this to Erica, but I have a file that is called My COVID Time Capsule, and it's a journal for kids, but it doesn't require them to generate all of the thoughts. It's more of planned, like things to note about their experience during this pandemic, and it's actually really cool. So I can distribute that, and you guys can ask Erica for it if you would like it. And then always fun to do something relaxing. I know we're in Florida and it's getting warm, but you can turn the air conditioning on and take a nice hot bubble bath.
Yes. Yes. And the last one, getting some chores done. I don't mean to say that it's fun to get chores done, but I will say I finally got to cleaning my whole house yesterday, and you do feel a lot better, I think, and more relaxed in a clean environment, even if it only stays that way for a couple days with kids. But it does help you just feel more relaxed to be in a relaxed environment. So the actual act of the chore might not be that fun, but at least it passes the time, but then you can feel better after you do it. So it can be good as well. Okay, so I'm going to wrap up our slides with just some resources, but I just want to cue you into these so that you don't breeze over them, because there's some really good stuff here. But there's a program called Active Minds that has a link called Coping and Staying Emotionally Well During COVID-19 Related School Closures. So it's this link, we can get this to you. Some of the tips that they share on this page are answering questions with your teen or your child, sharing strategies to cope, and as Dr. Driscoll said, modeling those strategies to cope, meaning engaging in them yourself so that your child sees you doing these things can be really helpful. Things we've already said, limiting exposure to coverage of the news, regular routines, keeping a schedule. But this link has additional resources and tips and tricks you can try about homeschooling and teaching at home and managing time. So check that out. I think that this is a productive link. And then here are some additional resources. The CDC has a page on managing anxiety around COVID, and it links to a bunch of other sites that can help give you tips and tricks. Helping a child cope if your child's struggling. Even though the folks that are on the call today, it doesn't sound like your children have had a whole lot of anxiety, but if others that view this video later, find that their child is struggling, know that that's a great link there to help with your child coping. A couple videos, SAMHSA's disaster preparedness line, how to cope with isolation and quarantine. So even if it hasn't happened for you yet, if there comes a time in the future where you have to really self-isolate, meaning like you've been exposed to COVID or you have COVID and you need to self-isolate, this is a great page for tips about how to stay emotionally well during quarantine and isolation. And psychological first aid tips from the National Child Traumatic Stress Network if children are really struggling with their mental health during this time. I will just add, a lot of these resources can be helpful broadly for anxiety, so they do relate to COVID, but if you or your family member struggles with anxiety more broadly, some of these can be great tips as well. And then just to know this is there, SAMHSA has a disaster distress helpline. The phone number is on the screen. It's a 24-hour-a-day, 365-day-a-year national hotline. The sole purpose of it is to provide immediate crisis counseling for people who are experiencing emotional distress during some kind of natural disaster, which COVID fits that definition of a natural disaster. Previously, we may think of this as like a hurricane or something that's impacted weather related, but this can also be things like a pandemic. So thinking about using this hotline or passing it on to someone who you think may be in crisis, it's toll-free. There's multilingual counselors on this line. Unfortunately, some folks are feeling a lot more distressed right now, especially if they have lost a family member or they've lost their income. And this disaster distress helpline can be really beneficial in times of crisis. So just know that it's there and you can pass it on if needed. And then that's it for the slides that we have, but we definitely will stay on the call if you have any questions or additional thoughts. Dr. Driscoll and I both have our emails on the screen, so you can please reach out to us if you have additional questions, but we will pass the resources we talked about today on to Erica and JDRF so that they can distribute to you to use as you'd like. But we'll stay on for a bit if you have any additional questions.
And thank you for joining.
Yes, thank you for joining. Appreciate, and thank you for your participation, for talking as well. It's always good.
Thank you for the presentation.
Absolutely.
Thank you. I do have a quick question. We've been talking a long time, but I guess like the main thing is if a type 1 was to get COVID and they were super sick, and like, what do you suggest? That we do go to the hospital? We just call the doctor? Do we call the endo? Like, what's the protocol?
That's a great question. So I think that might be, well, two things. So JDRF has a great resource page that Erica, you can link to as well, but it's like a sick, what you should do if you get sick page. And they've edited it right now to in the time of COVID. So it has some great things that you should be looking out for, like paying extra attention to ketones, paying extra attention to checking blood glucose levels. But I would definitely say if you ever are worried it's an emergent situation, call an emergency service, call 911, go to the emergency room, if there's something that's really pressing. But otherwise being prepared and knowing what to do. So having your physician's contact number handy and potentially, calling sooner rather than later if symptoms start coming on. Your healthcare providers are now, trained and ready to assist with COVID symptoms. And I think that they'd be more than willing to talk through, like, does this entail you going into the doctor's office? Should you go to the emergency room? How can you best keep yourself safe? But I will also say, by and large, I think COVID is really impacting people so differently. And so that said, one person may have very mild symptoms and be okay, and one person may not. And so being proactive, if you do notice anything, and talking to your healthcare providers is really, really important. Even if you may see it as mild and maybe not worth a call, it still might be worth a call just to double check and make sure that things are okay. So don't feel guilty or hesitate that you're taking up time in doing that. I think, healthcare, that's what we're here for, to really help you assess that situation.
Okay, thank you.
You're welcome.
I have a question. Can you hear me?
Yes.
Okay, so this is worst case scenario situation. If my child ends up in the hospital because of the virus, I hear that a lot of people end up in the hospital and they're alone. If it's a child, am I allowed to be in the hospital with my child, or am I not allowed to be in the hospital because I don't have the virus?
That's a good question.
Unfortunately, go ahead.
No, go ahead.
I think it's going to vary by each hospital, whatever their policies and procedures are. I think it's going to depend on their census, the number of people in ICU or in the hospital in general. And so I don't think that we can give you a definitive answer, unfortunately.
Yeah, there's no general guideline as far as minors COVID in the hospital, I guess.
Yeah, not that I'm aware of.
I think, I don't think we can give you a definitive answer either. And honestly, I think even within individual hospital systems, it's shifting and changing based on the prevalence of COVID in that hospital and resources available, which is a constant kind of change day to day. I've heard a couple of stories that one parent is allowed in and then they have to stay in the room and they're not allowed to leave. And so they end up kind of isolating in the hospital room with their child. But that's anecdotal from, one story in one situation. So I think if any advice, like, I know it's really hard to have that uncertainty, but my only advice there would be to try to learn what the hospital is telling you from the beginning. So if heaven forbid you end up having to be admitted, asking that question at the beginning of, am I allowed to leave the room once I go in? just to be prepared for those answers. And again, they may shift and change during the course of the hospital stay, which you may have no clue for. But at least you
I
can
am.
be prepared as you can.
And she's talking. These are participants.
Thank you.
Any other questions?
I had to unmute myself. Oh. This is kind of off topic, but not so. So, anybody have any information about diabetes camp for the summer?
Yeah, American Diabetes Association has canceled all the camps.
Oh no.
Yeah,
That's
I know
sad.
that they're working on doing some things to do some virtual setups, but the in-person camps have been canceled.
And that goes
Okay.
for Friends for
Sounds
Life. If anyone here goes to that, that's going to be a virtual event this year.
Yeah.
Oh yeah.
I'm sorry to be the bearer of bad news.
Oh, yeah.
I know.
A
Very
lot
disappointing.
It is. I think a lot are trying to be really creative with virtual experiences, but yeah, it's still definitely a bummer.
Yeah.
Total bummer.
Yeah, I'm sorry.
Hmm.
All right, anything else?
Thank you for joining. And
Yeah, thank you, everyone. Yeah, enjoy the rest of your evening.
Thank you for the presentation, Kim and Sarah. We really appreciate it.
Yeah, no problem.
Yes, thank you.
No problem.
All right,
Bye.
everyone, enjoy the rest of your day.
Stay safe.
Thank you. Bye.